Next, we're going to talk about the difference between contractile tissue and non-contractile tissue or inert tissue. So tissue that's considered contractile is pretty much muscles and tendons. So if a muscle or tendon is the issue and a muscle or tendon is what's causing the pain, we can determine this, A, by doing isometric resistive testing. And in a perfect world, when you do an isometric resistive testing, there's going to be absolutely no movement of any other structures besides the contractile tissue. So that might be a little challenging, but for it to truly test if there's a contractile tissue restriction, you want to make sure there's no movement. So just the contractile tissue is firing when you're trying to resist the different directions. If that is painful for the person, that's indicator that it could be contractile tissue at fault. Usually with contractile tissue issues, active range of motion in one direction will be painful, and then passive range of motion or stretching it in the opposite direction will also be painful. Now, for an inert tissue, that's anything that's not contractile. So nerves, bursa, cartilage, any of these other structures, blood vessels, all these other things are considered inert tissue. So if any of those are at fault, usually you tend to see active range of motion and passive range of motion are painful in the same direction. So you tend to see a different pattern of restriction. Now, there's 4 different types of inert tissue patterns that you may see. You can have pain and limitation in every direction. You can have pain and limitation or an excessive movement in just one direction. You can have limited movement that is pain-free, or if there's no lesion, you're going to have full range of motion and no pain.